Okay. As many of you know, bypass surgery is one of my biggest things in my career, in my contributions to the field of neurosurgery. Anyway, so that's called STA to MCA bypass surgery. So I'm gonna very briefly show you that. I'm doing this lecture very organically because I'm reminded. Let's go back here. Okay, of some of the talks that were given yesterday. Okay, let's show you this procedure. So what you're seeing here is the following. Okay, so what you're seeing this is the STA brought from outside. That's his mouth right there. So that's the superficial temporal artery. Okay. And this here is a branch, a tiny branch on the surface of the brain of the middle cerebral artery. And we are planning to attach this to this to bring more blood flow to the brain. Okay. So let's do that. So you see, I'm putting a suture into the STA. Now I am attaching it to the so the idea is this. So we have a small opening here in the MCA, and we're attaching the STA by putting a suture right there. There's going to be a suture right here. Then I'm going to put sutures here and here to attach. Okay. So you see what I'm doing? I'm putting these sutures in, and this is how I'm tying them. This is, of course, done under the microscope. It's very fine technical work. So that's that. I'm reminded of that based on one of the talks one of your students gave yesterday about the treatment of moya disease. Okay, so this is how we're doing. We're attaching the superficial temporal artery to the middle cerebral artery. Okay. This is very finicky work because these are tiny vessels and tiny suture, and you're trying to tie that under the microscope. There's fluid there, there's CSF. So it is kind of, you have to kind of get used to it. It's just a very finicky, very fine suture that you're seeing there. You're holding with very fine little instruments. So you can, now you see I'm attaching a sidewall. Right there, another suture. Okay. We, of course, train people doing this in the lab quite a bit before they even touch a human being. This is not you start doing in people. It's so finicky. This is something you learn a bit. You do this kind of thing. You see how I've attached this here, the STA to MCA bypass. Now I'm removing, so this is now attached, okay? The artery is attached to the surface of the brain right there, okay? See how the artery now, this outside artery, the STA is supplying one of the branches of the MCA to supply the brain with blood. Okay, let's go back to where we were, okay. So go back to, I diverted a little bit just to kind of, because I remembered some of the talks from yesterday. So that, what I just showed you would be done on the surface of the brain. But now we're gonna go back to this area we want to enter, this kind of high prize territory, which we're calling the skull base. I just wanna make sure you're understanding the vocabulary, that you're understanding we're gonna use a Sylvian fissure to come down here to get into this area, all right? Silikia, please watch my time because to give me heads up when like I have 5 or 10 minutes left because I want to respect the time of the conference.
Sure, sir. Sure.
All right. So to get to this area that we're talking about, which is this area right here. Remember, this is bone, the skin up here. Okay. How are we gonna get here? Let's start from the beginning. Well, we're gonna have to make an incision. Okay. So we make a skin incision right here. Okay. This incision is all behind the hairline. The hairline is going to be somewhere here. Okay. So it's not. So once so that it's not visible for cosmetic reason. Okay. So we reflect the skin back. Then there's fascial layers. We reflect them. Then this here, right here, is the temporalis muscle. Okay. As you can see, I'm not very good with writing and spelling, and there's a delay in the way this time. So please do not grade me here. If you were to grade me, I would get very low marks. But anyway, all right. So once we do that, then we're gonna cut this muscle and we're gonna reflect it downwards this way. So only the bone is exposed. All right. So. Then we want to get down to an area that is, I'm going to really talk to you about it because this is the part that you need to really understand. I'll show you how we're going to get there in a minute, but first I want to tell you what our target is. All right. So our target is an area where it's constant, so always looks the same in every patient. It's a very constant anatomy. We're going to have the two optic nerves, right optic nerve. This is, we're looking from the right side, okay, now try. And this is a left optic nerve. Right next to the optic nerve in a carotid artery. Right here. Okay, so right next to it, lateral to it, is internal carotid artery. And what I showed you earlier, the internal carotid artery divides into two main divisions: the middle cerebral artery and the anterior cerebral artery. Okay. Now, before, when I was showing you the diagram, I was showing you from below, which is how you see it in anatomy books. But as a surgeon, you're not seeing it from below, but you're seeing it from above. So you have to kind of orient your head around it, okay? So this is the anatomy that you have to be very familiar with. So what happens? If the patient has a carotid artery aneurysm, this is, for example, would be what we call posterior communicating artery aneurysm. Here would be an aneurysm called a carotid bifurcation aneurysm. Here would be an aneurysm we call the anterior communicating artery aneurysm. And on the MCA, there'll be aneurysms we call middle cerebral artery aneurysms, okay? So those are how aneurysms form, and that is a part that we get to in doing this kind of surgery, all right? So let's go next. This is an anatomic dissection of exactly what I just showed you, okay? In a cadaver. So this is our friend, the right optic nerve. This is the left optic nerve. And of course, this is our friend, the internal carotid artery, right? Which is in direct relationship with the optic nerve. Constant anatomy, okay? So you will see it in every surgery you do. And this is how you see it. So this is the right side, this is the middle cerebral artery, and this is anterior cerebral artery, okay? So that's what we're trying to get to, and that's what we are trying to understand in these kind of surgeries. How are we going to get there? We're going to get there through opening the Sylvian fissure. Let me show you how that works real quick here. See if I can get this thing going. So we are opening between that Sylvian fissure I just told you about, between the frontal lobe and temporal lobe, to enter this area, our target area we're trying to get to. And that's a technique. You see in my left hand, I have a suction. In my right hand, have a device we call a bipolar, okay? And I'm going between the two lobes, so I'm not going through the brain. And that's a safety aspect of doing this kind of surgery, okay? So what you're seeing is very fine, meticulous work being done to really open into this area, to expose it so that we are able to really, finally work between the arteries, the veins that exist in the Sylvian fissure, to be able to safely get down where we're going to go in a minute here, okay, which is the target area I just showed you. You see how I'm separating temporal lobe from the frontal lobe.
It's my pleasure to welcome you to the first lesson of the cerebrovascular and sculpting of the surgical implications of what is going on here. So for this segment, what we're going to do.
Okay, I'm showing you a little bit from the, I'm going to talk to you about the courses we're doing, but let me review that anatomy where we're going with you just a little bit more here.
We can appreciate this relationship of this artery as it enters the subarachnoid space. We are going to look at its main branches, okay? That are going to be coming off here, 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 and another small one here.
Remember, this is a frontal view of our friend, the carotid artery, that divides into anterior cerebral artery and middle cerebral artery, okay?
And we are going to talk about the pathologies of to expose the internal carotid artery.
So this is what I want to show you. So I'm showing you here now the whole concept of what we talked about so far, okay? It's how we're going to get there. This is a Sylvian fissure right here that I was just showing you.
I want you to appreciate here that we have a craniotomy we call a frontal temporal craniotomy right here, okay? And specifically, the name of this craniotomy is a pterional craniotomy. The other thing I want you to notice is this specific structure right there that you're seeing, that I'm going to expose to you right here, and the best way you could see it is right there. That is our optic nerve. Now, as you know, and I've been discussing this with you, the close relationship between the optic nerve and the carotid artery that I described. So the carotid artery will be here, deeper in, below the bone, and that's the optic nerve. So now that you three-dimensionally understand where the optic nerve enters the orbit, right there, it has a close relationship to the carotid artery. So by looking at this three-dimensional model, it gives you an understanding for us to expose the carotid artery. We somehow need to go from here, from this point here, to that point here. How are we going to go from there to there? By opening the area that we are calling right there, that I'm going to show you better. We're calling the Sylvian fissure. By entering the Sylvian fissure, which is between the frontal and temporal lobes, it will allow us to access the cistern in which both the carotid artery and the optic nerves sit.
And let me just...
Now, I would like to share with you a cadaveric dissection to go over the anatomy that we have so far discussed. So this is our optic nerve on the right side. This is the optic nerve on the left side. The carotid artery, we have been discussing the segment, which is a supraclinodal segment. The supraclinodal based on the anterior clinoid structure, which is right here. That's a piece of bone. And this segment is our internal carotid artery, which is in the supraconoid space. Okay. Next, we go to our two main division points, which is the middle cerebral artery and then of course
I'm sorry, guys. Looks like we lost Sir. We'll just get him back. Hello, Sir. Sir, you are on mute, Sir. Hello, Sir.
that exist that allow us to get to various areas of the skull base, which are just natural trajectories that allow us to do a lot of different things. Yeah, we're having all kinds of connection issues here. Let's see. Okay. Now let's go to a real situation. We have explained the path where we need to go. Let's go into a real situation in a real surgery and go through this surgery ourselves. So our idea here is to go to that so what we're trying to do here is, again, this is a real surgery now. This is a right optic nerve. This is a right internal carotid artery. Okay. How did we get here? Through the Sylvian fissure that we just opened. So we got here through the Sylvian fissure. Okay. So.
Sorry to interrupt you, sir, but we cannot see your screen actually.
Sorry. Sorry, we're having some technical issues here. Yeah, if you cannot see my screen, let me know right away, please. Can you see it now?
Yes, sir. Now we can.
Okay.